If you're struggling with erectile dysfunction, it's not in your head. And it also may not be related to your testosterone levels. It may not even be your pelvic floor muscles that are causing you to have erectile dysfunction. So what could it be? Well, if you're anything like my patients, you may be shocked to find out that your blood pressure may be a contributing factor. So we're going to talk about how your blood pressure can contribute to erectile dysfunction. So what is erectile dysfunction? Well, an erectile dysfunction is when you have the inability to obtain or maintain an erection. There's sometimes some individuals may notice that they can get an erection, but then the next time they can't. That can also be considered an erectile dysfunction. You don't want to just say, oh, I'm getting older, so that's why I'm experiencing these difficulties, because it does not have to be a part of normal aging. So if you're noticing symptoms, you're having a hard time obtaining or maintaining an erection, you want to make sure that you're speaking up and that you're checking your blood pressure, because your blood pressure is a vital sign, and we want to make sure that we're addressing something that you can easily prevent and manage. In order to obtain an erection, you have to have healthy blood flow. Well, high blood pressure is usually an indication that blood flow is not healthy. When someone has high blood pressure, their amount of blood that is actually able to get within the blood vessel can start to decrease because the blood vessel itself can begin to narrow and also become more stiff. That is something that happens naturally as we age. But on top of that, if you also have unhealthy lifestyle habits that can contribute to you having high blood pressure, that can further worsen the situation. So you want to make sure that you are checking your blood pressure so that way you know where you stand. Healthy blood flow means for a good erection, because the penis itself is going to rely on the blood flow. You don't have good blood flow, you won't have a good erection. When it comes to managing and treating high blood pressure, we know there are various medications that can be beneficial. There are also some lifestyle changes that you can make to help with your blood pressure, therefore improving blood flow and ultimately improving the ability to obtain an erection. These are conversations I typically have to have with patients when they come to me because of erectile dysfunction. Because if we're not taking care of some of the root causes and root issues, no matter what I do at the pelvic floor, the issue may persist. So taking care of lifestyle factors such as lack of sleep, consumption of alcohol, smoking, high stress levels, those things can impact your blood pressure. There are also some other things that can impact your blood pressure, which is why I like to take a look at individuals' lab work. Knowing what someone's magnesium levels are, also knowing and understanding what the potassium levels are like and their calcium levels can give you insight. There are times where physicians may recommend that men who have high blood pressure take one or several of these supplements. Before you add anything into your routine, remember that supplements count as medication, but they're not always regulated. So you want to work with a provider before you just grab anything. You want to make sure that you actually need it and that you grab something that's appropriate for you. And that is not going to react with other medications that you're taking. So lifestyle is a huge factor when it comes to managing blood pressure, which means that lifestyle is a huge factor with being able to obtain and maintain an erection. If you want to treat erectile dysfunction, you have to focus on your blood pressure, which means you have to focus on lifestyle changes. When it comes to eating a healthy diet, you want to minimize the amount of sodium that you're getting. So one big thing that you can do to help minimize that is avoiding processed foods as much as you can. If it comes in a package, you want to read the label and make sure you understand how much sodium is actually present. When you're cooking, preferably you're cooking with whole foods, minimize the amount of salt that you're adding to the foods. There are other herbs that you can use to try to season the food so that way it has a good flavor as well. And mentioned before you take any supplements such as magnesium, potassium, or calcium, make sure you speak with the provider so that way you know if it's something that you actually need to add within your diet. A lot of times we're quick to just grab anything, but it may not be something beneficial for us, so you want to make sure that it's something you actually need. Those are just a few lifestyle things that you can do in addition to some of the common things that you hear, such as cutting out smoking, cutting out drinking, and exercising on a regular basis. You want to make sure that you are doing cardiovascular exercise. And if you're someone who doesn't like to exercise, walking counts. So take care of your body so that way you can take care of your blood pressure. So that way you still can have an erection. It sometimes really is that simple. And this is a conversation that I have to have constantly with men when you're seeking out care for erectile dysfunction. You doing more and more Kegels to get your pelvic floor stronger, it may help, but if we don't take care of the root cause because of blood flow being an issue, which blood pressure itself can predict, then at the end of the day, you're still going to have problems obtaining and maintaining that erection.